Margaret had done everything she was told. At 71 years old, the retired librarian from Ohio never missed a morning dose of her blood pressure medicine. Every appointment ended the same way. Her doctor smiled, looked at the numbers, and said, "Your blood pressure is under excellent control." On paper, everything looked perfect, but Margaret didn't feel healthy. By lunchtime, she was struggling to keep her eyes open. A simple trip to the grocery store left her drained. Reading her favorite mystery novels, something she'd loved for decades, became impossible because she'd fall asleep after just a few pages. She quietly accepted it. "I guess this is what getting older feels like," she told her daughter one afternoon. Fortunately, her daughter wasn't convinced. She encouraged Margaret to visit another physician for a fresh evaluation. The new doctor reviewed her records, asked detailed questions about how she felt throughout the day, and noticed something that had been overlooked for years. The diagnosis hadn't changed. Her blood pressure was still well controlled, but her treatment did. A simple adjustment to her medication and dosage changed everything. Just weeks later, Margaret's energy returned. The dizziness faded. She was walking farther, sleeping better, and enjoying life again. Her blood pressure numbers barely changed. Her quality of life did. Stories like Margaret's are far more common than most people realize. I'm Dr. Michael Carter. If you or someone you care about takes medications such as Amlodipine, Losartan, or Lisinopril, today's discussion could help you have a much more informed conversation with your healthcare provider. These medications have helped millions of people lower their blood pressure and reduce the risk of heart attack, stroke, and kidney disease. They remain some of the most important treatments in modern medicine, but there's another side to the story that often receives far less attention. As we grow older, our bodies process medications differently. Changes in kidney function, liver metabolism, muscle mass, and circulation can all influence how a drug affects us. Yet many people continue taking the exact same medication and the exact same dose for years without anyone asking a simple question: how are you actually feeling? Too often, appointments focus entirely on blood pressure readings. If the numbers look good, the visit ends. Meanwhile, symptoms like constant fatigue, lightheadedness, swollen feet, persistent coughing, or difficulty concentrating are written off as normal aging instead of being recognized as possible medication-related effects. That's a problem, because successful treatment isn't only about reaching a target number on a blood pressure monitor. It's about helping you stay active, independent, mentally sharp, and able to enjoy everyday life. In today's video, we're going to explore 6 important facts that every person taking common blood pressure medications should understand. We'll discuss why different medications work in completely different ways, which side effects deserve closer attention, why routine laboratory monitoring matters, and how blood pressure goals may change as we age. One section, in particular, surprises many patients. It's about a symptom millions of older adults blame on getting older, even though it may actually be connected to their medication. Later, we'll also discuss why a blood pressure reading that appears perfect isn't necessarily the safest target for every older adult. Before we begin, I'd like you to think about one simple idea. Many people assume that if their blood pressure numbers are controlled, then their treatment must automatically be ideal. Unfortunately, that's not always true. I call this the numbers versus well-being trap. Here's what I mean. First, treatment guidelines are based on large clinical studies involving thousands of patients. Those guidelines provide valuable direction for physicians and have saved countless lives. However, no guideline can perfectly represent every individual sitting in an examination room. A healthy 55-year-old and an 82-year-old taking multiple medications often respond very differently to the same treatment. Second, the dose that produces an excellent blood pressure reading may not always produce the best quality of life. Sometimes a medication controls blood pressure beautifully while also contributing to fatigue, dizziness, or other symptoms that slowly reduce independence. Finally, good medical care isn't only about treating a disease. It's about treating the person living with that disease. The goal isn't simply lower blood pressure. The goal is helping you live longer while also living better. As we go through today's 6 points, keep asking yourself one question. Do my blood pressure numbers reflect how healthy I actually feel? If the answer is no, that's an important conversation to have with your healthcare provider. Let's begin with something surprisingly few patients are ever taught: the difference between the 3 most commonly prescribed blood pressure medications and why understanding those differences matters more than you might think. Number 1. Not all blood pressure medications work the same way. When most people are prescribed medication for high blood pressure, the conversation is surprisingly brief. Your blood pressure is elevated. Take this pill once a day. See you in a few months. For many patients, that's the entire explanation. That's exactly what happened to Robert, a 68-year-old retired truck driver. During a routine physical, his blood pressure had been consistently higher than recommended, so his physician prescribed Amlodipine. Robert filled the prescription, followed the instructions faithfully, and never questioned it. For nearly 3 years, he took the medication every morning without really knowing why that specific drug had been chosen or how it actually worked. One day, while visiting a new physician after moving to another city, he was asked a question no doctor had ever asked before. "Do you know why you're taking amlodipine instead of another blood pressure medicine?" Robert laughed and admitted he had no idea. That conversation changed the way he viewed his own health care. Here's why it matters. Although amlodipine, Losartan, and Lisinopril all lower blood pressure, they accomplish that goal in completely different ways. Amlodipine belongs to a group called calcium channel blockers. It helps the muscles surrounding your arteries relax, allowing blood vessels to widen so blood flows more easily. Losartan belongs to a class called angiotensin receptor blockers, often shortened to ARBs. Instead of relaxing blood vessels directly, it blocks the action of a hormone that normally causes those vessels to tighten. Lisinopril works one step earlier in the same hormonal system. It belongs to the ACE inhibitor family and reduces the body's production of that vessel-tightening hormone before it can exert its effects. The destination is similar, the path is not, because each medication works differently, each comes with its own benefits, potential side effects, and precautions. Some people tolerate one medication extremely well, but experience bothersome symptoms with another. Others may have additional medical conditions, such as diabetes, kidney disease, or heart failure, that make one class more appropriate than another. That's why understanding your medication isn't simply a matter of curiosity. It's part of becoming an informed participant in your own healthcare. At your next appointment, consider asking your healthcare provider, "Why is this medication the best choice for me compared with the alternatives?" A good physician should be able to explain the reasoning in language you understand. Knowing the answer helps you recognize possible side effects, understand treatment goals, and feel more confident about the care you're receiving. Because once you understand how your medication works, you're much more likely to recognize when something doesn't feel right. And that brings us to one of the most overlooked side effects affecting thousands of older adults every day. Number 2, swollen ankles aren't always just a minor side effect. Linda enjoyed taking long evening walks around her neighborhood. At 73, she stayed active, volunteered at her local library, and rarely complained about her health. Then, gradually, something changed. Her shoes began feeling tighter. By the end of each day, her ankles looked noticeably swollen. At first, she assumed it was simply part of aging. When she mentioned it during a routine appointment, she was told that ankle swelling was common with amlodipine and usually wasn't anything to worry about, so she stopped mentioning it. Instead, she bought larger shoes. She elevated her feet every evening. She planned outings around how uncomfortable her legs would feel by late afternoon. Little by little, she became less active. Months later, her reduced mobility contributed to balance problems and several near falls. Looking back, she wished someone had taken her concerns more seriously. Swelling caused by medications like amlodipine isn't uncommon because the drug relaxes arteries more than veins, Fluid can collect in the tissues of the lower legs, especially around the ankles and feet. For some people, the swelling remains mild. For others, it can interfere with walking, exercise, daily activities, and overall comfort. While the swelling itself isn't always dangerous, it should never be dismissed without proper evaluation. Persistent swelling may occasionally signal another medical condition, such as problems involving the heart, kidneys, veins, or lymphatic system. That's why any new or worsening swelling deserves a thoughtful discussion with your healthcare provider rather than being automatically attributed to medication or age. In many cases, there are options. Sometimes lowering the dose reduces the swelling. Sometimes switching to another medication class provides similar blood pressure control with fewer side effects. In other situations, physicians may recommend combining lower doses of different medications rather than relying heavily on one drug alone. The key message is simple. You shouldn't have to choose between controlling your blood pressure and maintaining your quality of life. If a side effect is affecting your mobility, limiting your activities, or making everyday life more difficult, it's worth bringing up again, even if you've mentioned it before. Never stop taking a prescribed medication on your own. Instead, work with your healthcare provider to determine whether an adjustment could improve both your blood pressure and your daily well-being. Because controlling blood pressure should help you stay active, not make it harder to enjoy the life you're trying to protect. Unfortunately, swollen ankles aren't the only symptom that often gets overlooked. The next side effect is one that sends countless people searching for allergy medicines, cough syrups, and even lung specialists, when the real cause may be sitting inside their medicine cabinet.